Bezans Healthcare apresenta Mulher PODcast, o seu podcast de saúde feminina, de médico para médico.
Sejam bem-vindos ao Mulher PODcast, o podcast da saúde feminina para médicos. Meu nome é Dr. Luiz Steffen, eu sou diretor médico da Bezans Healthcare e eu tenho hoje, nesse episódio, um convidado muito especial, Dr. Ludwig Kissel, da Alemanha. Ele é especializado em ginecologia e obstetrícia e tem um extenso currículo. Vocês estão vendo aqui que eu tenho que ler tudo porque é muito extenso. Ele estudou na Universidade da Escola de Medicina de Heidelberg, na Alemanha, na Escola Médica de Londres, no Reino Unido, depois fez pesquisa no Instituto de Saúde em Bethesda, nos Estados Unidos, em Maryland, e ele é reconhecido por sua contribuição significativa para o campo da ginecologia e endocrinologia. Para vocês terem uma ideia, ele tem mais de 800 publicações. E ocupou vários cargos de liderança, incluindo a presidência da Sociedade Alemã de Endocrinologia Ginecológica e Distúrbios da Fertilidade, ele é atual presidente, foi presidente da Sociedade Alemã de Menopausa, foi presidente da Fundação Alemã de Pesquisa em Endometriose e é membro da Sociedade Alemã de Obstetrícia e Ginecologia, bem como das Sociedades Conjuntas de Medicina Reprodutiva. É muita coisa. Ao longo da sua carreira, o Dr. Ludwig recebeu vários prêmios pela sua pesquisa, incluindo reconhecimentos da Sociedade Alemã de Pesquisa em Endometriose, da Sociedade Alemã de Ginecologia e Obstetrícia, dos Institutos Nacionais de Saúde, da Sociedade Alemã de Endocrinologia, da Sociedade Japonesa de Farmacologia. Enfim, a vasta experiência do professor Ludwig e o conhecimento dele fazem dele uma autoridade respeitada no campo da saúde feminina. So, thank you, Professor Ludwig, for coming to Brazil and participating in our podcast. We are talking to special people too. So I'd like to introduce yourself. I already gave a brief demonstration of your CV, but you can talk about yourself.
Yeah, well, first of all, I have to thank for inviting me to this magnificent city and this very prolific company with a lot of interesting and important products. It's been here some time already, but I think I will have to come back again. My main interest is on the field of gynecological endocrinology with regard to menopause and with regard to contraception and hormone action. So that's my interest, and from that point I'm interested in endometriosis and also breast cancer. These are the main topics I do, and apart from that I do a lot of surgery, so I am able to connect the different questions we have, and it's interesting to see how important it is to exchange international knowledge in this field, because women's suffering in that field is worldwide. So I think even the Global Economic Forum has raised the problem of menopause women to one of their top priorities. So I think if the most important economical forum says that, then it must be actually a very important thing. And that's why I'm happy we are talking about this point, and I would like to help doctors and patients to understand the background of the use of HRT and other agents.
Okay, so let's start with some questions to you. You were talking about the importance of the woman in menopause. Could you share with us when is considered the appropriate time to initiate treatment for menopausal symptoms, and what criteria doctors should consider when making this type of decision?
Well, first of all, I think the problem should be viewed from the patient's point of view, from women. And I think as soon as they have their problems, which can be even before their menopause actually is fully recognized, which means when they don't have any bleeding anymore. So some of them have actually problems, vasomotor symptoms, actually some years even before. So if you look at from the patient's point of view, some of them actually need treatment even in this perimenopausal period. And some of them actually have less symptoms, and some have so severe symptoms that they can't live their proper life and can't actually do their jobs. So I think it is a matter of discussion between doctors and patients when they really need it. And I think that should be recognized. And the major point is that when women are younger, in the younger period of their time, then according to the data which we understand, is more helpful to start and initiate earlier than start late. So as we know, WHI studies have been initiated much later than actually we are using the initial period. So that's a big difference, and that's actually not very helpful, because all the problems are actually getting visualized, and it's getting more obvious at latest years. So the main message, I think, is to start early, and there are even data showing that if you initiate early, and the North American Menopause Society recommends this, to start early, and then you have benefits for cardiovascular. Whereas later on, when the WHI study did that, then you don't have any benefits. So starting late is just not agreeable, when should not be done, and that's why I do earlier. And actually, you can carry on then later on. We had in our publication just in the important journals that even at the age of 65, if you start early, you can still do it without major risk factors. So it's different than when you start too late. So early start is a good thing to do.
Great. And you know that the first symptoms that appears and causes a lot of distress and discomfort regarding vasomotor symptoms. But as estradiol levels drop, other symptoms will arise. What are they? For example, vaginal atrophy and etc. And what are the associated risks for all these?
Yeah, I think there are two major groups. One group is what patients actually recognize themselves. These are the initial vasomotor symptoms, hot flashes, and sweating, and even not able to sleep adequately, which can be a major problem. So these are all hormone deficiency problems. And after some time, they have also problems with hormone withdrawal in organs such as vagina, which needs these hormones. Otherwise, they can't have the adequate function and protection. So these are initial problems, and then there are the long-term effects on bone, cardiovascular, which obviously benefits from adding hormones to it. So these are the two aspects of it. So we think that the initial symptoms should allow for starting a treatment, and then also use treatment, let's say symptoms at the vaginal area, and these are the atrophic symptoms, and that comes gradually. So patients sometimes don't think one could treat it, and that's why when you do the exams, you should tell patients that it would be helpful for them. And often they are just too afraid to do anything, and that's not really a reason not to start.
Yeah, so the burden is much more than only symptoms. We are talking for osteoporosis, for example,
Yes.
yeah.
That's the second part, which is much more difficult to explain patients, because they don't have the feeling and don't have the need. They don't have the symptom right now. So the problems arise much later, and at a time when you probably are unable to do much anymore.
Okay.
So that's why initial start, as I said earlier, is helpful also for the long-term effects.
Okay. Regarding all these topics about the new position as starting earlier, not like the WHI, can we say that we are in a post-WHI world and that there's a better perception regarding safety of hormones nowadays?
Yeah, I think that's quite true, especially when we look at the scientists and clinicians who actually publish WHI, and they realize that if you just take certain negative aspects, you can actually be very harmful with your publication. And it was surprising for me even to see that so many years later, they published data to say that they didn't mean to say that HRT is not advisable. It just should be checked according to the individual patient. So it's more and more papers coming out actually from the authors themselves, who just say that one should be aware that all the benefits, which has not been discussed so much, but just the negative side. So doctors and patients became just too afraid of using hormones and treatments, and that has changed within the last years. So we are actually a post-WHI period where the pendulum goes back again, and where it is more important to understand the diversity in one patient and to see that you can do a lot of advantages, and one should not just be led by data which are so many years back. So we are actually coming back to the state where the advantages are much more in the forefront.
Okay. And do you believe that, can you say that the hormone phobia is justified in today's scenario? On one hand, we have a scenario of hormone phobia brought by the WHI 20 years ago. And on the other hand, we have in Brazil an issue of misuse of hormonal implants, pellets that we talked before, that are not regulated by the sanitary or the health authorities, you know. What can you say about this? Do you have this in Germany?
Well, starting with the implants, we don't have this excess of excess use of implants. And I think from the medical and pharmacological point of view, this is just is not justifiable to have a mix of something which actually haven't studied. Even when we look at HRT, the licensed products, these have been used in so many women, and it has been studied to see what's the effect. If you use it on an individual basis and over the counter and pharmacy products in implants, you can't just tell what I actually achieving. So it's almost impossible to have that standard of care and that high quality of what you have with the licensed product. So it's just not understandable if you just add as much hormone as you think you need, and it's produced not in the standard way and studied in the standard way. So it's a big difference.
Okay. Another question, Dr. Ludwig. A common concern among many women is the possible association between hormone replacement therapy and the risk of breast cancer. Especially breast cancer. I think you mentioned that you work with breast cancer. It's one of the areas that you do your research. Based on your experience, how can doctors help patients understand and assess the risk?
I think you're absolutely right, and this is it's not just in Brazil, I think, and it's quite worldwide. And there has been such a focus on that point, and that patients became aware that so much talk is about it, and there's a hormone phobia all over the world. And it's totally unjustified because even the WHI study showed that estrogens alone didn't increase breast cancer. Actually, it even reduced it a little bit. And if you look at all the data with hormones and problems with the breast, you just see that there is no increased mortality, for example, with any of the HRT. So this fear is basically unjustifiable. You have to select maybe some patients who you would be more careful about. But in general, as we see from our studies, and even the WHI study showed that the initial steps in breast cancer development is not dependent on hormones. They could show it on the in situ cancers, which is, I think, is very important. So once you have a cancer, you can promote it maybe, but that's totally different than initiating a cancer. So you don't initiate cancer with these drugs, and that's why this homophobia is actually not justified. So there has been actually a study about the fears of women with regard to what they will get with age, what kind of disease, and they overestimated their breast cancer risk almost tenfold than it actually happens. They underestimated other things like cardiovascular things. They just thought that will happen only to men, but in reality, that's far higher risk than breast cancer risk, although everybody speaks about it because it's very openly discussed. But in reality, the actual numbers are totally against that homophobia.
Okay. And it's true that other factors contribute much more to the increased risk of breast cancer, like you can comment on alcohol, not practicing exercises, obesity. So can you comment about this?
Yeah, I mean, there have been studies comparing it. I mean, if you talk to patients, you have to balance your advice. You can't just talk about just the drug. You have to talk about the rest. And it's interesting that if you are obese, especially if you are severely obese, your risk of breast cancer is way beyond anything hormones can ever achieve. And if you have unfortunately, if you have a drink, actually 2 per day, your risk of breast cancer is significantly elevated and beyond the effect of hormone therapy in any conditions. And lack of exercise is probably one other factor, which is, so you have a multifactorial effect on breast cancer, and you increase this risk, or this risk is much more increased than any of the statistics which have been shown for any hormone therapy. So it's we are probably afraid of things which are not so risky then, and should consider other things more.
Okay. So with this last question, we come to the end of another episode of Mulher PODcast, Women's Podcast. So I'd like to thank you once again, Dr. Ludwig, for your presence and for our people, our listeners here. If you want to make any final consideration.
Yeah, I think the time, as you've shown, is very difficult for doctors, but also for patients, because of this fear, which is led very much is need to be rationalized. So we have to have all the evidence, and I think it's very difficult to get that. So doctors, but also the pharmaceutical companies, are asked to help patients to put that in perspective, because otherwise many women just don't get the treatment they should have. And we all of us are working on it, and I'm glad to be part of one of the meetings here in Brazil, which is focusing on that point. And I thank you very much for your kind invitation.
Ok, thank you. Esperamos que vocês tenham gostado do assunto. Esperamos vocês no próximo episódio para que a gente possa continuar com esse assunto sobre a segurança da reposição hormonal. Um abraço a todos.